All right, dental students and new graduates, congratulations. You made it through dental school. You jumped through the hoops, you got that diploma, and soon the license. But let me tell you something, and I say this with all due respect, your real dental education is just beginning. If you're feeling a mix of excitement and perhaps a little bit of now what, or even I still don't feel fully prepared, then this video is specifically for you. Today we're talking about starting your dental career the right way. I want to give you a practical, no-nonsense roadmap to accelerate your learning curve, avoid common pitfalls, and set yourself up for a truly successful, fulfilling, and yes, profitable career in dentistry much faster than if you just try to figure it out all on your own based on your dental school experience. Let's be brutally honest for a moment. As a new graduate, there is an enormous amount that you do not yet know. In fact, what you don't know far outweighs what you do know about the practical realities of day-to-day dentistry, running a business, and truly connecting with patients. Dental school, for the most part, gets you your license and provides a foundational understanding. It teaches you some hand-eye coordination and dexterity, but it does not teach you how to do dentistry efficiently. It does not teach you how to truly communicate with patients in a way that builds trust and gets case acceptance. It does not teach you how to make money, how to manage a practice, or how to lead a team. Much of what you learned, while important academically, won't be as directly applicable or as helpful as you might hope or think in the real world of private practice. So where do you start when there are so many facets of dentistry that you need to master? My strongest recommendation, the first and most crucial step, is this: find a mentor. And not just any mentor, find a successful, experienced dentist who practices the way you want to practice, someone whose results, patient interactions, and practice style you admire. Then your initial goal should be to emulate them, to copy them as closely as possible. Forget trying to reinvent the wheel based on your limited dental school experience. That path to true competence and efficiency will take you forever. Instead, choose someone who has already figured a lot of this out, someone who's been doing this successfully for a while, and make them your starting point. Copy the way that they talk to patients, the specific phrases they use, their tone, their demeanor. Copy how they conduct their exams, how they diagnose, how they present treatment plans. Copy their procedural workflows, the materials they choose, the techniques they employ. For now, try to set aside many of the rigid, often impractical protocols you might have learned in dental school. Those things are often not very helpful in a real-world productive practice. Think of dental school as the place where you began to learn hand-eye coordination and basic dental science. But the real-world application, the art and business of dentistry, that starts now, and learning from a seasoned pro is your shortcut. You didn't learn how to be a truly efficient, how to truly connect, how to manage, or how to be profitable in school. You learn that in the trenches, ideally alongside someone who has already mastered it. So here's the order of things I would strongly advise you to focus on as a new dentist looking to accelerate your growth. Step 1, master communication skills. This is critical. Before you even worry about the speed of your preps, you need to learn how to talk to people effectively. Learn the distinct purpose and flow of a comprehensive new patient exam versus a recall exam versus a limited or emergency exam. Understand what information you need to gather, and more importantly, how to communicate your findings and recommendations in a way that the patient understands, trusts, and accepts. Learn what you should say, and just as critically, what you shouldn't say. Observe your mentor. How do they build rapport? How do they handle objections? How do they explain complex treatment in simple terms? I have worked with many new dentists, and I am often amazed at how few communication skills they have. It is so bad. I don't really want to go down that rabbit hole with stories right now because there are just too many of them. Now, step 2 is I would develop real-world diagnostic skills. After you have a reasonable handle on basic communication, your next focus should be on diagnosis. Now, this is where it can get tricky. It often takes new dentists a few years to, let's say, recalibrate their thinking from the often overly cautious and theoretically driven diagnostic mindset of dental school. When you get out, approach diagnosis with an open mind. Talk to experienced, successful dentists, study how they diagnose. Emulate their diagnostic criteria as much as possible in the beginning. And here's a piece of advice that will save you a lot of grief. Don't assume that you know more than them, because you almost certainly don't. If you find yourself disagreeing with a diagnosis from a more experienced dentist, don't immediately condemn them or think that they're wrong. Instead, Humbly ask them to help you understand their thought process. A good general rule of thumb when leading dental school should be, if I am not agreeing with this experienced dentist, I am probably the one who is missing something. Maintain an open, teachable mind and let them help you understand. There are very few things more annoying in our profession than a brand new dentist who comes out acting like they know more than the people who have been successfully practicing for decades. Please don't be one of those. Humility and a willingness to learn are your greatest assets right now. Step 3. Systematically master basic clinical procedures. Once you've established a baseline level of function in your communication and your diagnosing, now you can start to really hone your basic clinical procedures. I recommend starting with fillings first, and then crown and bridge work second, and these will likely be your bread and butter. Again, the key here is to copy the protocols, workflows, materials, and techniques used by a productive, efficient, and high-quality dentist, hopefully your mentor. Write down their detailed workflows for each common procedure, I mean step by step. Then your initial goal is to replicate that workflow exactly as they do it, consistently. Don't start second-guessing their materials or techniques right away. Just do it their way for a significant period of time. Practice it until you can reliably replicate their process and achieve similar results. Only after you can consistently replicate what that experienced dentist is doing, only then should you start to think about tweaking, adjusting, or trying to improve it. Your first goal is to establish a new baseline for how you perform that procedure. A baseline learned from proven success, not from a dental school theory. Do this for all your common procedures. This approach will save you years of trial and error, frustration, and inefficiency. So if you're working with a dentist and they don't use a custom tray for a certain type of removable impression, and that's what you were taught you must do in dental school, don't freak out. Don't lose your mind. It's okay. Keep an open mind. Watch, learn, and ask questions about why they do it that way and what their outcomes are. This process of emulating a successful mentor should help you establish a new, much higher baseline for your clinical and practical skills, putting you years ahead of where you'd be if you were just trying to build up upon your dental school foundation. Because frankly, just starting from where dental school left you will take you far too long to reach true proficiency and efficiency. Now, once you've established this new baseline by diligently copying a successful mentor, I want to give you a specific framework to guide your own continuous improvement for each procedure. As you start to use your mentor's protocols as your new foundations, here's how I want you to focus on improving each of those procedures in this specific order. Phase 1 is improve quality. Your absolute first priority once you have a working protocol is to achieve consistent, high-quality clinical results every single time. Don't worry initially about your speed, your efficiency, or anything else. You have to be able to perform the procedure to a high quality standard, predictably. Focus on this until you are confident that your outcomes are consistently excellent. Phase 2 is decrease complications. After you feel good about the consistent quality of your work, your very next focus needs to be to systematically decrease any and all complications. As you encounter complications like post-op sensitivity, open margins, debonding, whatever it may be, you need to analyze why they're happening and adjust your protocol or technique accordingly. Your goal here is to get to a point where complications are extremely rare, practically a non-issue. Stay in this phase, diligently working on this until complications are no longer a consistent concern for that procedure. Phase 3 is improve the patient experience. Once your quality is consistently high and complications are truly rare, your next step is to focus on making the experience of that procedure a positive practice-building event for the patient. Look at every aspect of that procedure through their eyes. How can you make it more comfortable, less stressful, more reassuring? What can you say? What can you do? Your aim is to make it an amazing experience that they'll positively remember. Then phase 4 is you should be focusing on improving your speed and efficiency. Only after you feel confident that your quality is excellent, complications are minimal, and the patient experience is extremely positive, then it's time to focus on improving your speed and efficiency. This is where you strategically look for ways to cut down your procedure time without sacrificing any of the previous 3 crucial steps. How can you streamline your setup? Can you combine steps? Can you improve your assistant utilization? How can you reduce wasted motion? Keep working on this until you feel like you've maximized speed and efficiency while rigorously maintaining the quality and low complication rate and great experience. Then phase 5 is to improve profitability. Your final step in mastering a procedure is to focus on its profitability. This might involve adjusting your fees appropriately for the value and experience that you're providing. It might involve refining how you diagnose and present the need for that procedure. You're essentially dialing in that procedure so that whenever you perform it, it is not only clinically successful and a great experience for the patient, but also a very profitable and successful procedure for the practice. These 5 phases: quality, complications, patient experience, speed, efficiency, and profitability, provide a structured way to approach the improvement of every single procedure in your clinical arsenal. So dental students and new grads, my message is hopefully very clear. Find a great mentor, commit to emulating their successful systems first, and then use this 5-step framework to continuously improve. This will save you years of struggle and put you on the fast track to becoming a better clinician, a better practice owner, if that's your goal, and finding more fun, fulfillment, and reward in this incredible profession. If you found this advice valuable and you want more practical strategies to accelerate your dental career, make sure you hit that subscribe button. Now, I'd love to hear from you new dentists and dental students. What is one area, communication, diagnosis, a specific procedure, or perhaps finding a mentor, that you feel is your biggest immediate challenge or focus as you start your career? Let me know in the comments below, and let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.